Sadly, the infant and maternal mortality rate is higher in Detroit than in other cities in our state and really across the country.
But a new collaboration is looking to bring those numbers down by launching a home visiting program that pairs nurses with first-time mothers.
When I first found out I was having a baby, I felt very lost. I didn't know what to do.
Most women have felt just like Char Fuqua after learning they are pregnant with their first child. It is exciting, but there are also many questions about the unknown.
I was going through a period in my life trying to figure out, okay, I'm having this baby, I'm nervous, I'm scared, but what does this look like for me?
Sadly, studies show 13 out of every 1,000 babies born in Detroit die before their first birthday. That's almost twice the rate in the rest of the state. The issue of infant mortality is also linked to maternal mortality. African American women, regardless of their socioeconomic status, are 3 to 4 times more likely to die from pregnancy-related complications compared to a white woman.
I know what it's like to need support and to need someone to come and give you guidance. And not just the typical guidance, but to talk about your health concerns, to think about where you can get resources, where and who you can go to. I didn't have that.
Knowing the need, Shai Johnson, who is from Starfish Family Services, is working with Nurse Family Partnership to launch an expanded program in Detroit to help provide those resources and bring the mortality rates down. Specially trained nurses regularly visit first-time low-income moms in Detroit, starting in early pregnancy and continuing through the child's second birthday. Melissa Klein is a supervising nurse with NFP.
The first thing we do is develop a therapeutic and trusting relationship with mom.
From there, they provide prenatal support, regularly visiting during the pregnancy. Once the baby is born, they help with everything from breastfeeding to putting your child to bed.
Establishing routines. So a young woman has yet to really establish that in her life yet. So we try to help her recognize the importance of that, and we'll just work visit by visit in building up a routine with her and how important it is for her to build up that routine with her baby so that they can kind of sync up and find some peace.
To help me latch my baby on, because I didn't know what to do. He was not eating. I was literally feeding him through a syringe. So she was able to meet me where I was at and to still feed my child. So no matter where you come from and what experiences you have in life, you need help as a mother.
Char happens to be one of the success stories. She is now a mother of 2 young, healthy children. She was so inspired by her nurse, she became a midwife and has even started her own nonprofit. For Shai, whose children are now grown, she knows the statistics aren't going to change overnight. But she's hopeful, since Detroit moms have now somewhere else to turn.
I lived it. So in living it, I want to make sure that there are resources to moms that were like me.
And it's a free program for low-income mothers. You just have to qualify. And we want to let you know it starts September 23rd. And the phone number to call, 1-888-NFB-BABY.
Every mother and every child deserves to have a fair shot at life coming into this world and delivering a baby. And they're giving people a shot at that by making sure that they're there.
And the nurses are helping with more than just the baby. I mean, they're also helping to sometimes, you know, where they live is a big issue, or education. So they help to break down those barriers and link them up with the proper resources, so then they are able to be healthy, empowered, strong mothers, and they can go from there and raise great children.
Just like the mother we just saw in the piece.
Yeah,
who was
she's doing great.
A success story. So good to see.